I think the work that is being done by AAKP is so critical to patients all around the country. Their ability to advocate on our behalf ensures that everybody understands the impact of kidney disease and what they can do to help us.
Now everybody is fully understanding that to achieve a better quality of life, you really need to listen and take into consideration what the patient views as a better quality of life for them.
I always have fun at an AAKP event. How could you not have fun? You're with people who understand completely what you and your family are going through. So it's not just for patients, AAKP. AAKP should be for the family of patients, because when a patient has kidney disease, the family has kidney disease.
Belonging to an independent advocacy organization like AAKP gives me the confidence that I can represent them and people living with kidney disease to represent them honestly.
Our objective over the coming decade is to reach people around the globe and not just limited to the United States, because kidney disease is a universal disease.
They encourage patients to be the voice for their care and treatment. And I don't see that as much in other organizations. And I feel like that is so necessary for patients to feel like they have a voice and they can make change in regards to their care and treatment.
I think the AAKP, by being a patient-oriented group, impacts not only the medical devices, but pharmaceuticals and pretty much anything that's to do with the patients, because those companies will respond more to a patient than they will to a doctor, I think.
It's important to be a patient advocate because to whom much is given, much is required. I was given this gift of life back in 2008 by my donor, Leanne, rest in peace. She was a deceased donor. So now if I can use my voice and use my platform and influence to impact lives, and my favorite word, why not? And why not become an organ and tissue donor today?
We spend a lot of time here, particularly in DC, in the nation's capital, talking with staff, with the legislators, and trying to help them understand exactly what the patient perspective is on anything that's kidney or renal related. It's a great honor to be able to do it. Our numbers are growing, and part of our strategy is for them to understand that we will come and visit and talk with them, and we represent the patient voice, and we want that to be heard, and that's how we do it.
People around the world who are sick and suffering with kidney disease need a voice of optimism, they need the tactics, and they need the reinforcement from fellow patients here in the U.S. to do what they do and demand a change in the status quo. And we fully intend to arm patients around the world with the tools they need to be more vocal with their governments, regardless of the ideology of their government, and to demand solutions and to defend private sector companies and investors who are willing to get into this space and deliver more innovation for patients.
AAKP opens the door so that it broadens the whole horizon. You're one person. When you belong to AAKP, you suddenly become a tribe.
Welcome to today's Healthline webinar from the American Association of Kidney Patients. Back to school, COVID-19 considerations for pediatric kidney patients and kidney patient households. Thank you for joining us today for important information regarding the coronavirus and kidney disease while going back to school. If you have been tuning into our webinars over the last several months, you have had access to information from AAKP's trusted federal partner, the Center for Disease Control and Prevention. AAKP is proud to have the CDC as one of our long-term federal strategic partners, and we are honored to serve as an ex officio member of the CDC Health Infection Control Practices Advisory Panel. My name is Erin Kale, and I am Director of Stakeholder Operations for the American Association of Kidney Patients. I oversee our patient education and grassroots engagement activities, including our Ambassador Initiative, which comprises highly motivated and engaged patients and caregivers around the country and the globe. These individuals have a direct connection to kidney disease and wish to raise awareness and provide support to others navigating the challenges of this chronic disease. AAKP's Healthline webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives, and we work to ensure that the patient has a central role in research and guidance that are designed to determine optimal approaches and strategies for providing healthcare services, assistance programs, and access to new products and services. This is especially true during national emergencies such as the coronavirus pandemic. At this time, I'd like to introduce AAKP's Chair of Policy and Global Affairs, Paul Conway. Paul has managed kidney disease for 40 years, including nearly 3 years on home dialysis, and for the past 23 years as a kidney transplant recipient. Paul has an extensive background in policy and public service, including time on the staff of the U.S. Secretary of Education. He serves as AAKP's representative to the CDC Health Infection Control Practices Advisory Committee. Paul, I'll turn things over to you.
Thank you very much, Erin, and thanks for bringing together our experts and audience today. I'd like to thank everyone who has shown a concern for kidney patients and the threat of coronavirus who joined this call today, and especially to the families who are impacted by kidney disease. This is a very challenging time for the country, our medical professionals, and the kidney community. As America prepares for the start of another school year, families that have a family member or relative living with kidney disease, managing dialysis, or with a kidney transplant and immunosuppressive medication routines have very particular concerns. This is absolutely true in multi-generational households and for parents who not only take care of their children, but who also have the great responsibility of caring for older parents, whether in the home, if they're in assisted living, or if they're in a nursing home. I'd especially like to thank our expert panelists today for coming together to provide a timely, open, and well-balanced and factual discussion. AAKP has been very sensitive to patient and family concerns about COVID-19. We have produced over a dozen webinars on the disease and related practical concerns, as requested by kidney patients and their families. These webinars for dialysis patients, caregivers, transplant patients, and U.S. veterans were instigated by requests from patients and their families to AAKP. You will find that AAKP is very driven by patient concerns, and it's reflected in our programs. As Erin mentioned, AAKP is proud to have the CDC as one of our long-term federal partners. AAKP is quite honored to serve on the CDC's Health Infection Control Practices Advisory Panel. Earlier this week, AAKP hosted our second webinar with the CDC at our request, and we will be making that webinar accessible to listeners soon. Based on our other federal relationships, including with the Department of Defense and the U.S. Department of Veterans Affairs, AAKP will be conducting other expert webinars in the weeks and months ahead for patients and their families. For over 50 years, AAKP has served as the largest independent voice of patients in America. We take our role in educating patients and elevating their disease management insights and care choice preferences to policy leaders very seriously. I'm asking all who are listening today to stay connected to AAKP via social media, accept our free membership opportunity, and get involved with us. Through our Center for Patient Education and Research and our Center for Patient Education, Center for Patient Engagement and Advocacy, AAKP members have great opportunities to participate in policy work, clinical research, and clinical trials, and to shape the decisions that are made in Washington, D.C. about their own care. Your voice and your expertise matter, and Erin will make certain that it's applied and elevated accordingly. The coronavirus is and will remain a serious threat to all Americans, especially those with underlying health conditions and those who are immunocompromised, like kidney patients, for quite some time to come. Although AAKP has a great reach across the kidney patient population, really what it comes down to is patients educating other patients. And we need your help in this fight because COVID-19 is a serious threat to kidney patients. whether they're on dialysis, living with a transplant, or in the advanced stages of chronic disease. At AAKP, we offer our prayers to everyone who is facing this, to the families that are managing it, and especially to those families who have children who have kidney disease and are looking at making certain that they stay well educated and competitive and ahead of their peers around the world. Turn it back to you, Erin. Thank you.
Thank you so much, Paul. Our next slide just has a couple of images here. As Paul talked about, our Center for Education and Research is a very important part of AAKP, where we reach out and request to hear the patient and family perspective on various issues. So if you sign up as a free member to AAKP and you provide your email address, you will get periodic emails from us with important updates, as well as requests to share your opinions, your voice, and your perspective. So we hope you will share those with us. At this time, I'd like to introduce our first webinar speaker, Dr. David Hains. Dr. Hains is a professor of pediatrics and the section director of Pediatric Nephrology at Indiana University School of Medicine. He is a graduate of Indiana University School of Medicine and completed a Pediatric Nephrology Fellowship at Nationwide Children's Hospital. Dr. Hains has been awarded multiple academic and service awards and professional honors throughout many phases of his career, and he has established himself as a leader in pediatric nephrology nationally, specifically in the field of innate immunity and urinary tract infections in children with, and I'm going to pronounce this wrong, vesicoureteral reflux. He was awarded the Lyman T. Meeks Research Award for Pediatrics as a medical student, American Society of Pediatric Nephrology Trainee Research Award, Society for Pediatric Research House Officer Award, John E. Louis Foundation Advocacy Scholars Program inaugural class, American Society of Pediatric Nephrology Leadership Development Program, Harvard Business School Program for Leadership Development Fellowship Award, and the NIH Loan Repayment Award. He holds membership in numerous national professional societies and regularly reviews for many of the top journals in his field. He has participated in numerous study sections for the National Institutes of Health, including review of R01 applications and U54 O'Brien Urology Cooperative Research Centers. He has served in leadership of the Research Committee for the American Society of Pediatric Nephrology and currently heads their John E. Louis Advocacy Scholars Program. Thank you so much for joining us today, Dr. Hains. I'll turn things over to you, and you can let me know whenever you're ready for me to advance your slides.
Cool, thanks. Thanks for that wonderful intro. So want to talk today from the view of a pediatric nephrologist, how we get kids back into school safely and what our thoughts are and what we've learned during this pandemic. And where do we go from here, especially now that the time is upon us. So slide. Just want to get, I'll use these terms kind of interchangeably. So just to make sure everybody's on the same page, the virus itself is called, we call it SARS-CoV-2 or severe acute respiratory syndrome coronavirus 2. And then the disease that we all talk about when people get really sick and end up in the hospital is COVID-19, which is an acronym for coronavirus disease of 2019. Slide. So, you know, what makes this really challenging is that we see this wide spectrum of things, and we've seen this in our patients here at Riley, as well as just multiple other people out in the community see this. So the symptoms can pop up a couple days after exposure to even up to 2 weeks after exposure. So that's a really wide window of something to show up. We don't say, oh, I know this is going to happen in the next 72 hours like a lot of other infectious diseases. So this is tricky. And then we keep hearing about new symptoms that are being added or atypical symptoms. And this has been a moving target ever since February and March. So the common symptoms, or the ones that we talk the most about, are fever, cough, sore throat, muscle aches, headaches, GI problems like diarrhea, And then one of the unique ones is this loss of smell or taste. In kids generally have very mild symptoms. They may only have one or two of these things, and so that makes it extra challenging because for those of us that have kids, we know, or take care of kids, we know that pretty much they're going to check one of these boxes in the last 3 to 4 weeks all year round. So it becomes really tricky of, is this just normal kid stuff, or is this a mild case of COVID, but they're really contagious? So it makes us all very anxious as parents and as caregivers. Slide. So the people that we really know, as we've learned more and more through this pandemic, the people we know that are at risk for real severe disease, and anyone technically is at risk to some extent, but the most common people affected by severe disease are definitely those in older age groups. In adults, and I want to stress that, not in kids, but in adults, those with hypertension, diabetes, chronic heart and lung disease, and then any immunocompromised state. And that includes if you're on immunosuppression for transplant, if you're on dialysis, end-stage kidney disease, and advanced chronic kidney disease are immunocompromised states. People with cancer that have received chemo, all these folks are at risk for severe disease, and that makes up a lot of the American population. And we aren't sure yet with kids, but we're not seeing these same trends. So we're not seeing, we have a lot of kids with diabetes. We have a lot of kids with chronic kidney disease and on dialysis when you look at the country as a whole. We're not seeing the same things that the adult groups are seeing. And we're on the ped side of things, I feel very fortunate for that. So these are cases in Indiana, and just to kind of highlight the age group distribution of who gets this. So these are the most up-to-date numbers by age groups. And if you look at the top two bars, that's 2 decades worth of people, of kids less than 19. You can see that's far less than all the other just decade age groups. So we're not seeing as many positives in kids. We don't know if it's because we're not testing them or they are resistant to this for whatever reason. But you can see that young people, while we think that young people in general are relatively immune or we don't hear about them, they make up a significant number of the positive cases. But if we look at who goes in the hospital, next slide. If we look at those that are in the hospital, this is the same age group breakdown, but hospitalized people in the state of Indiana. And you can see that this really skews towards the older generation. So people over 60 especially make up the vast majority of people who get hospitalized. So while we see contagiousness across all the age groups, we see those that end up sick enough to end up in the hospital really being skewed towards older Americans. So we'll move on to what are we as pediatric nephrologists, because we're getting called a lot from parents asking what are our thoughts and what do we recommend for our patients. We see everything from kids with just blood in their urine all the way to dialysis and everything in between. So we've tried to make our best guess at based on the literature, based on the evidence, and what we think is best for our kids that we'll take care of. So we strongly feel that if we can safely get kids in school, that in-person learning is the best way to do it in children. And so we're really pushing for our kids to go to school. We do this with our transplant prior to the pandemic. Our kids that get transplanted, they are on lots of immunosuppression. They are at risk for having bad outcomes with different infections, but we really push to get them back in school. It's very important to us. So in-person learning isn't just about having an educational structure, but it's important for kids to interact with their peers. A number of kids rely on school for food security and getting a good meal every day or multiple meals every day. And then it's really important for families and kids to go have another setting, interact with folks for their emotional well-being as well. This applies to all the kids that we see in pediatric nephrology. So how do we do this? And Susie's going to get into this a little bit with the next talk, but basically social distancing, we've heard a lot about it. It's good. 6 feet apart. We want to make sure that schools are trying to do this to the best of their ability. Masks are good. If kids will wear them, and most kids will, we're in a good spot there. If we can do masks and distance, and then frequent hand washing and hand hygiene is really good. These are all things that we've known with our immunosuppressed patients and in our dialysis unit, and we're seeing this kind of play out on a bigger scale now. So when I talk to families and things like this, kidney disease affects the whole family. It's not just the kid. We worry about the kid, but as the caregivers, we also worry about the parents and who they come in contact with. And COVID's no different. So, I'm not as worried about the kids themselves getting coronavirus. I'm much more worried about them bringing it home and giving it to somebody who has a comorbidity at home that's going to put them in a high-risk category, or interacting with a grandparent who's going to have severe disease or a much higher risk for severe disease. So I really highlight that. I'm not as worried about the kids getting it. So going to school, if we get all the kids back in school, is this going to cause an increase in cases? And I think this is a really good question, and we don't know the answer yet. It might. Denmark and Israel saw different trends in their positivity in their population after reopening schools. They were at different places in terms of relaxing their social distancing measures. So it's not really comparing the same thing. There was also a report back in July from child care centers in Texas, and looking at them, the staff were twice as many of the staff as kids were positive in those centers. I don't know what that means. Could mean that kids are just less prone to this. And it could be that just adults are out and about in the community more and are catching it from other things. So the jury's still out on that, but I think we're all very attuned to this, and we're anxious for the answers. So the CDC, we've heard about the CDC partnering with AAKP. The CDC has lots of good information. It's changing constantly. So I direct you there. Here's a link here, but there are many other pages embedded there to look around on, and they have great tips and slide decks and whatnot on how to protect ourselves during the pandemic and what to do in schools as well. So in kids with kidney problems, what do we know so far? They just like other children have mild courses. Next. And the reports in kids with kidney disease are really limited. So there was a report on kids with nephrotic syndrome, and they were 259 kids that were on immunosuppression for their nephrotic syndrome. None of them had COVID overtly, and only one had a relapse of their nephrotic syndrome during the study period. So many viruses, if anyone out there has kids with nephrosis, at the cold or just during crud season, this is what triggers relapses. We're not seeing COVID trigger a bunch of relapses. And then during the first 3 months of the pandemic in the UK, there were only 5 cases in their chronic kidney disease population. None of those kids were hospitalized, and they didn't have any deaths from this. So this was very encouraging that we're not seeing a wave of really bad disease. Next slide. Here at Indiana, our fellow, Ashley Rawson, did a report on 2 kids with kidney disease that we saw. One was a dialysis patient. One was a kid with advanced chronic kidney disease and both kids were on chronic immunosuppression medications. Next slide, or next button. And both of them did great. One had fever for a day and a half, and the other one had anosmia or loss of smell. And this is similar to other reports. We did see that one of our patients was positive for 3 weeks, so it took a long time for him to get over it, which is common, and we see that in lots of other viruses. Next slide. I'm going to go really quickly through this, but people ask about testing. So there's 2 different types of tests. There's the nasal swab, which is a PCR test, and that tells us if you're infected right now. And then there's an antibody test that tells you if you had it. We do this on blood. This tells you if you had an infection in the past, usually 3 to 4 weeks ago. Next slide. You can, yep. So kids with end-stage kidney disease require dialysis. Next. Keep going. And these kids need 3 to 4 hours of dialysis 3 times a week. Here at Riley, we have a 1 or 1.5 nurse to every patient ratio. And we have 12 to 15 patients generally with 2 shifts on Monday, Wednesday, and Friday generally. Next slide. That means we have a bunch of kids and nurses that are in contact with one another. And here's a picture of our dialysis unit at Riley. You can tell that this is very difficult to socially distance. And this is going to be very similar to what we see in schools with teachers and whatnot. You can go through these, hit the enter, yep. So we have 5 beds, 3 isolation rooms, keep going. And at one point in time, we can have up to 12 people all in this area, much like a school. Next. So what we see here in our unit, keep going. So we drew blood on kids for 13 weeks, keep going, to look at antibody numbers. And this is what we found in our unit of antibodies in our patients. So we saw that with only 1 known case in our patients, we saw almost 30% of our kids developed antibodies over the course of the study. I think this reflects that even our end-stage kids can get very mild or disease that we don't even recognize. And the vast majority of them never even come to our attention. None of these kids were ill in the hospital and needed to be isolated, other than one that we caught very early on before all the social distancing measures had even started, and talk about coronavirus was just starting. So this was very encouraging to us that a number of people have been exposed in our area, and we've been able to keep everybody very safe through social distancing, through protective equipment like masks, gowns, and then frequent hand washing. And that's it. So Susie's going to talk now a little bit more about specific things with coronavirus.
Thank you so much, Dr. Hains. I'll share just a little introduction about Suzie. So our next speaker is Suzie Hedrick. Suzie has been a registered nurse, shift coordinator in the Pediatric Dialysis Unit at Riley Hospital for Children for the last 19 years. She also trains all the patients and parents that are starting peritoneal dialysis and hemodialysis. She completed her Associates of Science degree at Indiana University School of Nursing and her Bachelor's of Science degree at University of Indianapolis. Suzie is a 14-year volunteer for the National Kidney Foundation of Indiana, where she has been the co-coordinator of Kidney Camp. Kidney Camp is a camp for children ages 8 to 18 that have had a kidney transplant, are on dialysis, or are approaching dialysis. She also volunteers with her church and the Riley Children's Foundation. Thanks so much for joining us today, Suzie. Let me know when you're ready for me to advance your slides.
All right, thank you again for having me. I know there's so much anxiety about going back to school. Even with my own grandson, sending him back to school, it was really tough decision because of my husband being really sick. So, you know, even Dr. Hains talking about it, you know, sending my grandson to school, and then maybe could he possibly be bringing something home. So I kind of have a feeling that I kind of know what parents are feeling. So what I want to do is really talk about the safety at school. And talking about the hand hygiene, talking about wearing the mask, and then talking about social distancing, which we know all these things together is going to help. Next slide, please. Next slide. So the first thing I want to talk about, you know, we know that doing your hand hygiene is, and washing your hands is the #1 way to help fight infection. And in our dialysis unit, we are very particular with our kids when they come in. They know, even our little bitty ones, when we bring them in, they use their hand and raise it up towards the hand sanitizer And, you know, we've got a 5-year-old that's what she wants to go for. We have a 2.5-year-old, and when we put him in his bed, he's reaching up because he wants to hand sanitize. So this can be taught early on. And this is one of the best ways that we can help fight that infection, is making sure that we're washing our hands. As Dr. Hains said, that on the CDC gives you a lot of good information, and I was going to copy that link, but he had that link. You can go to that link, and they have all kinds of things about going back to school. They talk about hand hygiene, and I put the slide on here so you guys can see how to wash your hands. You can do it between 20 and 30 seconds. For little kids, telling them 20, 30 seconds is not, you know, good enough. So you can have people sing a song. So if you go to the next slide, please. There's a lot of songs out there that you can click on the internet and you can just go to and pick up some fun songs. Next slide. You can teach the kids how to sing Happy Birthday. Now, if they run through it really fast, that's a song that most kids know. Have them sing it twice as they're washing their hands. And when they're washing their hands, making sure that they're getting the palms of their hands, the back of their hands, and one part of the hand that is the most unwashed part of the hand is that area between your thumb and your index finger. Making sure that they do that. Singing Mary Had a Little Lamb, Row, Row, Row Your Boat, the alphabet song. So teaching kids their alphabet and they can sing that song. For your older kids, I don't know, Jolene is a song, it's a country song, and I should have brought up some more rap songs, but I didn't. I was kind of focusing on littler kids. But they have all kinds of ideas on the internet to help you to be able to know how long you are washing your hands. Another thing is wearing your mask. So this is so important. And if there's parents are on here, you know, if you have a chronically ill child, you know, when you come to the hospital, everybody's going to ask you to wear a mask. And for most of our kids that are chronically ill, wearing a mask is not a big deal. But to some parents out there, putting a mask on a kid might be a big deal. One of my pet peeves is when I see a mask that's worn the wrong way. So this is the right way to wearing a mask. You want to make sure the mask is up over the nose. You want to make sure it's pretty good fit around the face, and it needs to stay that way. And try to make sure that you teach your kids not to mess with their mask, not to pull on it, because if they do, then you're going to get that contamination on their mask and then they can get sick. So the next slide will show us the wrong way to wear a mask. And there's one of mine where you see people out, they've got their mask on, they're in the grocery store, or sometimes I've even seen parents walking around in the halls at the hospital and they have that mask down below their nose. That's not going to work. So you might as well not be wearing a mask at all. So making sure that you work with your children and showing them the right way to wear their mask. We have sometimes our dialysis kids will come in, our hemodialysis patients, they'll come in and they'll have it down and we're like, can you put your mask up over your nose? Like, oh yeah. And so then we're like, okay, hand sanitize, make sure you hand sanitize. So just making sure, and parents, if you're out there listening to this, your kids are going to follow what you do. So if you make a big deal out of wearing masks, then your child's not going to want to wear a mask. But if you put the mask on and wear it the right way and hand sanitize, your children are going to follow that behavior and it's not going to be that big of a deal. Okay, next slide. And then the next thing is social distance. This is probably one of the hardest things for kids. I had a friend that said, you know, we've been 3 months, we decided we were going to call our friends up and say, let's go have a play date with our children, and we're going to meet up at the park, we're going to be outside, the kids are going to wear a mask, and we're going to make sure that they don't, you know, go up and hug each other. And so they talked to the kids about it, and these were like 6-year-olds. and they had been going to school pretty close since they were in preschool. So they hadn't really been able to play. They saw each other on the phone, but they hadn't been in each other's sight in 3 months. And so lo and behold, she said, we tried to make sure that they understood. And when they saw each other, what did they do? They just ran to each other and hugged each other and said how much they missed each other. So that's the really hard part. And just teaching your kids that, you need to stay that arm length away. I know that teachers are really working hard in the schools. They're trying to do everything they can to make sure that your children are kept safe while they're there, making sure that they've moved things around in the classroom, kept a desk in between kids, but helping and bringing that awareness to your children when you're out. We were at the swimming pool one day, and my grandson and my granddaughter were talking, and they were talking to themselves, and then this lady started talking to them, and then they were just all right there with that lady was, and I had to go get them and bring them back and remind them, it's okay that you talk with her, but you got to keep your distance, because nobody had a mask on. So that's probably one of the hardest things, I think, is with the social distancing and making sure that kids understand that it's really important to keep that distance away from others. And next slide, I think that's my last slide. Yeah, that's my last slide. Thank you so much. And I think next we're going to have Emily talk about her feelings and what it was like sending Henry to school.
Yes, thank you so much, Suzie. Our final speaker today is Emily Whitacre. Emily is a wife, social worker, and mom to a kidney warrior and his younger sister. Emily's son, Henry, now 6, is 2 years post-transplant and is looking forward to starting kindergarten. Emily has served as an advocate for her son since prior to birth, as he was diagnosed with posterior urethral valves and required emergency surgery in utero. He's had over 40 surgeries since then. Emily has also served as a mental health professional in her community for the last 10 years as a caseworker and behavioral clinician, and she is a collaborator and contributor for an online mental health platform that is currently in development. Thank you so much for joining us today, Emily, which I'm sure is a pretty busy time for you. So we appreciate you sharing with us and look forward to hearing about how you've been preparing for Henry to go back to school.
Thank you so much, Erin. Yes, it is such an honor to be here. I love being able to share with everyone. It's just really on my heart. We always say in our family, turn your test into your testimony, your mess into your message. And so from the very beginning of our walk with Henry and our journey with Henry into the kidney world, we have kind of always walked upon it with a view of advocacy as well. So we know that sharing our story can possibly help others. So happy to be here. So happy to be here. I'm just going to be talking a little bit today about back to school, what it's going to look like, how you can deal with it as a parent, how you can help your kids deal with it, because it's going to be different. But it's important, right? School is obviously next to healthcare, it's probably one of the most important things in a child's life, getting that educational basis, getting that educational foundation that they're going to build on, and especially in younger years, like for kids like my Henry, who's in kindergarten this year, those first years are so critical, and there's so much development that's not just academic that happens. So school is really important. Education is so vitally important, but it's also important that you as a family, you find a balance that works for you, whether that looks like in-school learning or virtual learning. I know that some districts are offering a hybrid. I know here in Fort Wayne, we have 4 different school districts, and each one is doing something a little different. So our district was offering either in-school or virtual learning. They were not offering a hybrid option. And so we chose the in-school option, the traditional option for us. We just really felt that based on our guidance from our team and research and our own personal, the way that our family functions, it was the best scenario for Henry to be in school so that he could have those other interactions outside of just the academia. But someone, I think I was asked a question in an interview that what would the ideal situation be? And I don't think there is one. I think that's a trick question right now this fall. I don't think there is an ideal situation across the board. I think it's finding what is the best fit for your family. But I do 100% agree with everything that Suzie and Dr. Hains have said about masks, that the masks are super important. And as a kidney family, we're very used to wearing it. So Henry wasn't, too worse off for the wear when I told him he'd have to wear a mask every day with school. But that's different with every district too. Our school district made it part of the dress code actually this year. So it's in the handbook that students and employees, anyone present in the school, will have a mask on at all times. But that's different with every district. So depending on what you choose, I think it's just really important to kind of make sure that your child knows and the importance of wearing a mask regardless of whether or not your school requires it. You can go ahead to the next slide. All right, so what to expect? It's going to be different this year, you guys, no matter what. And one of the adjustments, I think, as parents that we have to make is that we might not get to be as involved as we had maybe hoped. And so for a family like ours, who, Henry's going into kindergarten, that was a little hard to swallow that we might not be allowed in the school. And that might turn into a will. We are not allowed in the school this year. So, there's no volunteering in the classrooms, no parties, no things like that. And that's different. And that can be stressful. And that can cause anxiety or be scary for you, your child, his or her teacher. And so it's just, the emotions are different this year than they might be going into a regular school year. But you can also expect help, and you can expect teamwork and cooperation, and for your child to be cared for and educated regardless of if there's a pandemic or not. I think that as kids who have medical special needs or maybe other special needs that might have been brought on because of these medical issues, that it's really important to have a good relationship with your school and your child's teacher, because the expectations of preparing them are still the same. So we can always expect that for our teachers and our elementary staff and our school staff to be there for our kids. So you can go ahead to the next slide. How to prepare for school. I was asked this so much, and I found myself even defending my choice a little bit. And so these are the things that I always went to when I was defending my own choice of sending Henry back to school, was just start a conversation. If you're worried about it, anything that you're worried about, start a conversation now with your child and with your child's school. You can be honest and open about your child's needs. It is okay to ask for a 504 if you need a 504. It's okay to ask for an IEP if you need one of those. Just having that open and honest conversation with your child's school about what your kidney kid or what your immunocompromised kid or what your medically fragile child might need, they have rights. And so it's really important to start the conversation, and then just be open with your child as well. Ask them what their feelings are. Kind of talk to them about how things might look different and what they can expect, and preparing them that recess might be different, lunch might be different, and there might not be music class. We are fortunate in our district that all of the specials are continuing. They're just doing them in a little different way. So I think that gym class is outside this year, and music class is being held in the gym where they can all sit, 6 feet apart. Desks are set up in the classroom where they're 6 feet apart. Kids aren't sitting at tables like they normally are. So these are all questions that you can ask of your school. What is the plan? What is the plan for return to learn? And then another way to prepare is to just be flexible. This is a learning curve for everyone involved. It's a learning curve for parents who don't have medically fragile kids. So it's definitely a learning curve for us as well. And so when we started our journey with Henry 6 years ago, we just took the mindset of flexibility back then, because you can think that you know what you're doing and that you have a plan, and something happens, and in the blink of an eye, that plan can change. So But that being said, there is also at some point, right, that a routine should set in. So as your child is going to school and or doing virtual learning, just keep your eye out, keep aware of things that are happening. You know, be talking to them about what they're eating, their water consumption, because those are all really important things to kidney kids. So one thing that our district is allowing is a water bottle to go to school with all of the kids, and Henry is allowed to have his water bottle right by his desk. He doesn't drink very much water without being prompted to do so. So his teacher was really good about coming up with a plan to help remind him about drinking his water. And then, so the routine is just, you know, he knows now that he needs to drink his water at school and he needs to eat lunch at school. So there are things that you can kind of count on as the school year sets in that teachers are going to know. And so if things are still slipping through the cracks, you know, a month into school, then I encourage you to, again, have a conversation with your child's school because we're our kids' best advocates. So, but as our kids' best advocates and their caregivers, we really need to practice self-care for both ourselves and our children because mental health is so vitally important, and it's been under attack since about March of this year. The mental health overall of state of the country, of the world is suffering, and there have been rates of depression and suicide and anxiety that are just skyrocketing. And so it's really important to practice that self-care. Find things that you and your child enjoy to do that help take the load off. And don't be ashamed and don't be worried about what those things might be, because everything is different for every family. But definitely practice self-care. Okay, you go to the next slide. And don't be afraid to reach out for support. You've got this. Your medical team is there for you. And just like Dr. Hains and Suzie have showed the CDC, there are so many resources that are available, that are out there for parents to help walk this journey, because we are not in it alone. Plug into places on social media. I know that there is a great group on Facebook. It's the Parents of Kidney Kids. And I'm in that group. My husband's in that group. We love it. We can post when we need support. We can post when we need ideas. We can post when we need to vent. Just be wise online always. You know, don't give out information. Trafficking is a real thing that we're seeing right now, so just be aware. But you guys, social media, there are so many avenues and there are so many outlets to get support that you don't have to do this alone. And you know your child best, so don't be afraid to advocate for them. Don't be afraid to stand up. Don't be afraid to ruffle feathers if you need to. You know them absolute best. And on that, you know what's best for your child, just like your neighbor down the street knows what's best for their child. So just remember that this is not a game of comparison, and that what is best for your neighbor might not be best for you. And so every family is unique. Every situation is unique. And I just really encourage you to talk to those who you trust about getting information and guidance on whether or not going back to school, what educational option is the right choice for your family. You know, we didn't just talk to our transplant team, we talked to our transplant team and our pulmonology team, you know, and our GI team. We wanted to hear from everybody, that, you know, there wasn't anything across the board in Henry's background that would say, oh no, he has to stay home. So, but that was for our family. And so for your family, it might be different. So just find what works for your family and be confident in your choice. Okay, next slide. I thought that was it. Okay, thank you.
Thank you so much, Emily. We appreciate you sharing your perspective and what has worked well for you and your family. We had an additional speaker that was scheduled to join us today, Mother Heather Bear. However, she has a bit of a family emergency and is unable to join us today. But I did want to share that her 5-year-old son, Blake, who is starting kindergarten, their family has decided to do kind of a combination schooling this year. So he will be homeschooled, and he will also have 5 hours a week with a homebound teacher from their school district. So as you see, not every family will be choosing the same option for their kids. And we were hoping to have Heather's perspective as well on this webinar. But I do want to encourage our listeners to look out for our September issue of our Renal Life magazine, where both Heather and Emily were interviewed about going back to school. So I hope you will look out for that. And it will be out in the mail very soon. And we will have an electronic version available by email and on our website as well. So thank you again so much to all of our speakers today, sharing this important information and what is surely on the minds of a lot of families out there. We'll go ahead and take some questions for our speakers. And I know a few came in during the presentations. Let's see, here's a question for Dr. Hains. My child has kidney disease, is on the transplant list, and our school district currently has plans for returning to school. Can you tell me what is the most respectful way to communicate to school officials that I am not sending him into school this year? Our school district leadership is not sounding very flexible, and I do not want him to be labeled as a problem student or me as a problem parent.
Yeah, I think that, I don't know the best way to do it other than just being honest about your concerns and your special circumstances. So obviously conveying that you don't feel comfortable sending your kiddo to school is important. Talking to having, it might not be immediate, but within a couple days, generally most school administrators or leaders can get on the phone. I wouldn't do this via email. I'd have a phone call. That way you can, tone is hard to understand in email, so they can hear your concern. And it also allows for timely dialogue where you can get answers immediately, as well as provide clarifications of why you're worried without having to write out a very long email that you may or may not have a chance to respond to their questions.
Thank you, Dr. Hains. Suzie or Emily, do you have anything to add to that question?
I definitely agree with Dr. Hains about making it a phone call or even an in-person visit. I mean, every school is saying nobody's allowed, nobody's allowed. But really, we have rights as parents for our kids, and it's our job as parents of our kids to advocate for them and what's best for them. And so sometimes it's a little uncomfortable and it's a little hard, but just definitely encourage that face-to-face or at least over the phone conversation. Because like Dr. Hains said, it's much easier to convey your message that way.
I agree. I think either in person or on the phone is the best way to communicate to your school leaders. Most schools that I know of have been doing either in person or some kind of hybrid where you go 2 days, 1 day, 1 week, and then 3 days the next week, or they are doing virtual learning at home. So maybe they can do something like that. Also, if your child needs one of the IEPs or one of the other things that Emily mentioned that I can't pull off the top of my head right now, look into that as well. But ultimately, you have to feel 100% safe in what you feel is right for your child to send them back to school.
Great, thank you so much. So I have a question, and I think this was for Emily. Can you tell me how you have been communicating with your family, maybe a little bit more about the process as you were deciding how to bring Henry back to school, the balance between getting adequate schooling and your child not falling behind and protecting them from COVID?
Sure. So it was not an easy decision. And I will actually 100% say openly that prior to going to our clinic in July, we were planning on doing school at home. We just had we felt for Henry that it was probably the best option. We figured he was going to be way too high risk. But then after talking to our team at Riley and getting the information that the kids really aren't as overly burdened by COVID, we went ahead and decided that being in school was the best spot for him. But our family was really shocked, and I will say maybe not necessarily as supportive as I thought they would be, and I apologize profusely if there's background noise. But I was just pretty bold about it, and I just told everybody up front that this is what we're doing, and if you have questions, you can ask me, but I am not going to defend myself constantly because he's my child. And for us, we have a rather unique situation. We have a wonderful support system, absolutely wonderful. But even though as involved as our families have been, they are not here on the day-to-day, and they are not here every single day with our kids. And so you just have to stay strong in your choice and communicating that you know what's best for your child. And while you respect other input and other opinions, that you're going to, stick to your decisions that are based on evidence and based on talking to doctors. You just got to kind of stay strong.
Great. Certainly not a decision to take lightly.
No, not at all. Not at all.
Great. Well, thank you. We have another question for Dr. Hains. My dear grandmother lives with us and goes to dialysis several times a week. I am very, very nervous about exposing her to COVID-19, and my kids would be devastated if that happens since Granny is their best friend. How do I recommend I balance this before I communicate to school leadership?
This falls into the category of me being much more worried about the people that may be exposed to your kid than the kiddos themselves. So I think that there are people here that do have these there are lots of people that have these special circumstances, and I think it's completely reasonable to say, hey, we're going to isolate, and unfortunately it stinks for the kids, and hopefully they have online learning for kids in that school system. But I think it's completely reasonable being very concerned about grandma's health, and the kids are definitely at risk for bringing it back home. So I think that is an instance where everybody has to be very, very cognizant and communicate that effectively to the school.
Great, thank you. And again, as you mentioned, kidney disease affects everybody in the family, not just the patient.
Agreed. And Erin, I would just add on to that too, that, and I think that Dr. Hains and Suzie would agree with this, that your kidney team, your dialysis team, your renal transplant team, wherever you are, your medical team is here for you. They are your biggest and best resource and asset as far as helping you communicate. And so I know that we're blessed at Riley. We actually have a social worker that's part of the Riley renal transplant team. I would totally encourage parents to investigate and see on their medical team if there is a social worker, because that social worker will be a huge asset in helping with whatever you might need as a family, whether it's referral for resources, whether it's just backup saying that, hey, this is a decision that we need to make for our family, but we need support. We need someone to help us back this up. So I would definitely encourage parents, if you are questioning at all, reach out to your medical team, see if there's a social worker involved or a coordinator involved that can help you.
Great, thank you, Emily. We have one final question that came in. This person actually has kind of a two-part question. My 5-year-old daughter has class 3 IgA nephropathy, but is not on any immune suppressive medicines, and we are managing this naturally. She wants to know if she is at greater risk because of this diagnosis, at greater risk of COVID-19, and what are the risks with ACE inhibitors? Some people have said that they are more at risk if they are on ACE inhibitors. Dr. Hains, do you have any thoughts on that?
Yeah, So have not seen any specific reports looking at, or at least reporting that IgA is associated with worse outcomes. So first part, I think that it's, I wouldn't, knowing what we know about the disease, it wouldn't make me more concerned, especially if she's not on immunosuppression. Definitely not concerned for anything different than any other kid. I think we'll wait and see, but IgA is a very common disease, especially in adults and worldwide. So I would expect that if there was something that was associated, we would have heard it by now, but we don't know for sure. In terms of ACE inhibitors, there were some early reports saying that ACE inhibitors and angiotensin receptor blockers, or ARBs, are medicines that we use either for blood pressure or to lower protein levels in the urine. That those were associated with worse outcomes. We feel like we are using those agents, and that story is still evolving. It's not as clear as these are definitely causing problems, and especially in kids. We're definitely not seeing severe disease in kids, all the kids that are on ACE inhibitors. We use them quite frequently. So the bottom line is I don't think that there's anything to be worried about ACE inhibition, and usually stopping it, and the reason why you're on it is probably more of a problem than any subtle risk that we would see increased with ACE inhibitors themselves, if it's even there.
All right, thank you. Thank you so much to our speakers and for responding to those questions. If you have a question that we did not get to during today's webinar, please email us at info@aakp.org, and we'll work with our speakers to provide a response. I have a few closing slides to go over to share some additional resources and information that may be of interest to you. We encourage you to join us as an AAKP member if you are not one already. We offer free membership to patients and their family members, as well as living kidney donors. And as we mentioned earlier, please share with us your email address. That way you will receive communication when opportunities arise, where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the patient voice and change the status quo for kidney disease care. You can also select to receive any of our 5 different electronic newsletters and subscribe to our printed magazine, AAKP Renal Life. We also invite you to follow our blog and join us on social media for all the latest news and announcements. AAKP is dedicated to helping patients understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and caregivers. By visiting our website at aakp.org, you can click on the Store button at the top of the homepage, where you will find a variety of educational brochures and online tools that you can order or download. I want to mention our AAKP Pediatric Kidney Pals e-newsletter that comes out bi-monthly. And if you have any topic ideas or if you want to write for us, please email us at info@aakp.org. We hold a number of events throughout the year, and these events are live streamed and recorded. If you visit our YouTube channel, you can watch presentations from our recent Global Innovation Summit with George Washington University, as well as our annual Policy Summit. And we hope you will join us virtually at this year's National Patient Meeting, taking place September 11th and 12th. Registration is free. It's a fun 2-day meeting. It will be very interactive. You'll hear from experts on everything related to kidney disease, caregivers, living donors, transplant recipients, dialysis, everything under the sun, and we hope you'll join us. I'd like to remind everyone that this webinar has been recorded, and it will be made available on our coronavirus resource page. And you can access that from our homepage by clicking on the big red button at the top of the page. We have a lot of wonderful resources on that page, including information from the CDC, as well as the Food and Drug Administration, National Institutes of Health, and other partners and allies. We would again like to thank today's speakers, Dr. Hains, Suzie Hedrick, and Emily Whitacre, for sharing with us important information to consider about COVID-19 and keeping your family safe while the school year starts back up. If you have any additional questions about what you heard on today's webinar, please send them to info@aakp.org. Thank you again for joining us today. Be informed and stay safe.